It's now 7:01.
I make a motion to accept the meeting minutes of March 17th.
I'll second that motion.
Okay, all in favor?
Aye. Dorville.
Linehan, aye.
Okay, Silver, aye. So moved. Minutes of the March 17th meeting have been accepted. Next on the agenda, Ruth.
Yeah, so basically, I just wanted to go over what the process is to replace irreplaceable me.
I know, I feel like I'm going to close with something special to say. I would have liked to have opened, but we're in the meeting now.
Okay, so Steve and the mayor met to discuss the future of this position. They've agreed to keep it the way it is as a joint position. And they agreed to have, excuse me, Wakefield involved in the selection process. So, so there's going to be a 5-member committee, each of the HR directors, and a member from the Melrose Board of Health, a member from the Wakefield Board of Health, and myself. So last night, the Melrose Board of Health decided that Caroline Lecitra is going to be their representative. And tonight, we need a representative for this board, just so you know what you're getting yourself into. The job was posted over the weekend. It has a deadline of April 30th, 2 weeks. And it's also posted on MHOA. And so what I talked to the Melrose HR director, who is extremely busy right now. And we agreed that instead of her screening and picking out the people to get interviewed, that we would do that. So, well, she's supposed to send them to me and I'll send it on to everybody, although I can just, create a distribution list and she can send them out directly to everybody who's the 5 people. And then I think what we'll do is have everybody submit their, depending on how many people apply, the top 5, the top 7, whatever, and reach a consensus on who we want to interview. The biggest challenge is finding a time that 5 people can actually be available for. So my thought is, once we have somebody from this board, that tomorrow I send out a couple of chunks of time and try to find, like a couple of mornings or afternoons or whatever now for like the 1st or 2nd week of May, so we can fast track this. And then people will know now what time to set aside. The more notice, the better. I mean, the concept was there to be overlap time, but at this point, unless the person's not working right now, by the time they give notice, there won't be any overlap. However, I'm still only 2 miles down the street, assuming we're hiring somebody who actually knows how to do the job. I think it's really more just showing the person, where everything is, but I don't think I need to teach them how to do the job. Going over the grants, where we're at. They'd be starting 1 week before the end of grant years. So going through, where we're at with different grants and paperwork and, that kind of thing. So I can always come back to do that. So anyway.
What is your official last date, Ruth?
Well, officially it's May 31st, but that's Memorial Day. So my real last day is May 28th in real life. So, again, if we can do interviews the first and or second week of May,
Yeah.
you know, the sooner we do this, the sooner we get somebody on board. So, so just keeping that in mind as far as, you know, who you feel or which of you are interested in doing it. And it may end up being like a Friday afternoon because the three of us, you know, the two HR directors and I don't work on Friday afternoons, so maybe they would have better availability, but we'll see. You know, I'll send out whatever the hell that poll is called. And
Doodle poll.
yes, that, and put out a bunch of options and let's see what people send back where all five of us can meet.
Okay.
So that bookcase looks like my bookcase, Laurel. Are you sure you're not in my office?
Okay, that's my way, no.
Okay, just checking.
This is my dungeon.
Got it. So that being said, I just wanted to explain a little bit about, you know, where we're at. And I mean, I gave 2 months and 1 week notice, which should have been enough to have overlap, but it wasn't. So,
It's a big job.
so anyway, the good news is that, you know, I've been strongly talking with the powers that be about classifying the job into a pay scale that is appropriate for the job.
Yeah.
So it is being posted at $111,000, which is actually more than I make now, but that's okay.
Wow.
I think it does show that the two communities respect the position, understand that it's a big job and big responsibilities and a large knowledge base. So I choose to look at it as a good thing and successful, at least for my advocating that it's an important job and they need to pay it appropriately. So that's good.
I believe that's happened to nearly every job I've left.
Yeah, I know. It does. It does.
Or the supports that you were begging for finally came because you had such a good idea. So,
exactly. So that's how life is. I get that. So anyway,
so you're really experienced. So I'm kind of surprised they went for that. But
talk amongst yourselves and decide what
Yeah.
you want to do.
Elaine.
Yeah, I am free. I'm
you?
interested in doing it. It doesn't bother me. I have no life. I am retired.
Okay, that was not why I said Elaine.
Well, Elaine also has been a health director, so
Exactly. That is why I said Elaine.
Yeah. I've also done. Yeah. I tried to get a health director before they made me the health director. But I am interested, and I would love to. I want her. It's a very, very hard person to replace, but
we're all replaceable.
Very, very brisk.
Well,
Laurel,
we're gonna miss you. Yeah, I just that was my thought, Elaine. It had nothing to do with availability. I could figure it out though. Fridays are no bueno for me. But it's much more your understanding of the breadth of knowledge that is required and how someone might problem solve. Certainly, I mean, I don't know if that person. So in the process, I don't know if that person wants to reach out to a bigger board or, we don't really even have time because our meeting is the third week of May, 2 weeks before, we hope to be done between now and the next meeting, right?
Yeah, and I mean, to be honest, it's not within the purview of the board anymore,
Right. Right.
So it's actually not even within Steve's purview. Technically, it's a Melrose employee position that's hired by the mayor, but I'm not arguing with the inclusiveness.
Right.
I had actually advocated the Medford model when Medford hired their last health director. They actually had me and the Malden health director screen the resumes, do the interviewing, and then we gave the top 2 to the mayor. And I thought that was a great model because let's face it, nobody knows what health departments do really, except people who are in health departments.
It's a true peer review.
Yeah.
Yeah. So I thought that was great. And so I was really pleased that they included me. I think we all know that there are some people that interview really well, look really good on paper, but if you know them, you're like, no.
Yeah.
So, you know, between Elaine and I, we know most of the people in this part of the state. So
I was about to say, with Elaine doing it, you're nearly duplicating that model.
yeah, so I think
Elaine,
it's
Elaine,
good.
Yeah, I do highly recommend that happens. So yeah, you know, it is an opportunity. However, you know, when interviews happen, that the person interviewing will have a flair for both towns. I think that's helpful.
Absolutely.
And you know, in hearing that, so I think it's advantageous to the applicant. But I can't even believe we're doing.
I lost my visual. There I am. Okay, sorry.
We can see you. So I don't know that we need a motion because it.
No, I think it's just a consensus thing.
Yep.
Okay, well, that's cool. That's great. I'm looking
Thank you,
forward to
Elaine.
working with Elaine.
Oh, you're welcome.
Might want to keep all that candy in the mugs.
Yeah. I do know two people have told me they've applied. But Polly hasn't sent me anything yet, but tomorrow, if I don't get anything from till Friday, you know, by Friday morning, I'll email her and CC everybody and just say, Polly, can you send us the resumes you've received so far?
Is there any value in allowing the board to see the finalists just to see what we're up against for an update, or no? Is that kind of out of the box?
Well, let me ask the HR people.
No.
I'll ask. I mean, I don't care.
Just
What?
nosy. I'm just nosy. I think
Yeah, I'll ask. I don't see what the big deal is. So anyway, yeah, I know two people have applied and she hasn't sent me anything, which means,
Okay. Well, that's something.
you know, she's not doing what we agreed to, but that's okay. You know me, I'll nag her. And I just think for me anyway, it's easier to see them as they come along.
It is.
Yeah.
And, you know, Elaine, if who I think applies does apply, I think there'll be at least one courtesy interview where I would absolutely not recommend this person, but to make it look good, we would interview them.
That's okay with me. We've done that before.
Yeah, due diligence.
You know, and Laurel, thank you for asking about, you know, having the board take a look maybe at the final two finalists. I think, Ruth, you should stress to them the fact that it's, you know, the board has to work with these people and they want to get an idea of this person has what has been our mission and what we're hoping for to continue. And maybe they have something that we've been looking for or something that we haven't been looking for. And I think it would be nice for the board to just get an idea of, you know, even if we don't have names, you don't have to put their name. You can put, you know, some other things. They can block out a name and just see experience or what their mission is or what their goal is. It might help.
Yeah, I don't think there's an issue with like maybe just doing the finalists or something, but whatever.
Yeah. Well, it also occurs to me looking at May that maybe we, just so that we have a little more time for transition, bump our meeting to the second Wednesday of May instead of the third, because.
Well, I think if you wait at least, I don't think we'll have a final person by then, but if you
Maybe
wait
she'll
till
wait.
the third,
Okay.
then we can announce it at the meeting. So
And then we can,
that would work.
and we have a week to welcome said person.
Well, you know, presumably that person's going to have to give notice. So
Right.
we're going to have to talk about what the transition is not going to be what was planned.
Okay.
So, but let's see who the person is, you know?
You never know.
I mean, we know that we have a stellar staff.
Yep.
So, you know, because you've done your job well. So I imagine there might be some interim leadership that could happen. When is Karen retiring? Is she giving-
Okay, so that was the next thing. That was part of my health director's report. So nice segue. So Karen's position was also posted and advertised. They're both on MHOA, and it's supposed to also go on MAPHN. I didn't check it, but Elaine, if you want to check it to make sure it's on
Check it.
MAPHN, we did give them the information because I think that's really the best place to be advertising. And again, they reclassified that position significantly. So between
Full time?
it's full-time now.
Yeah.
Unless something bizarre happens at town meeting or city council meetings where they don't approve it. It will be full-time effective, well, actually effective June 1st. We're hoping to have somebody on board for June 1st so that there's a month overlap, especially if they're not already on Maven. I think, and I'm sure Elaine will back me up on this, it's not hard to quote unquote learn Maven, but takes a lot of time to master Maven, the ins, the outs, the what ifs, every case that has its own particularities. And also the camps will be back this year. So that's in June is when we do all the camp stuff. So with both of them here, hopefully if we have 2 people working full-time in June, it takes a lot of stress off of Karen, which I think is extremely important to do right now. And will also make for a really good transition for that position. So, so both of those positions are posted. And that will be done the normal way. I'll go through them, interview them, blah, blah, blah. So that's all good. It's all good.
We need to get a team picture.
Pardon me?
We need to get an updated team picture before you go.
We do, definitely.
We tried to do one.
So I didn't do a written report because there's not a lot of things to talk about. I sent you the latest COVID numbers, which actually, I hate to say and jinx us, but they actually look good. Of course, this is school vacation week. So let's see what the numbers look like next week, because of course, a lot of people are traveling.
Ruth, just to prove to you that I was paying attention, I don't know why, but one of the dates in April says August. I think the 19th.
Oh, you mean on the spreadsheet?
Yeah.
Oh, that's weird.
It's so weird.
I repeat it going down. That's really weird. I don't know why you did that,
I'll
check it.
It's one way of proving to you that I read it.
No, no. So anyway, so we'll see how that goes. Stacy is still working 30 hours a week. Maureen Garapay, who, as you know, is on the other board and has been doing Wakefield cases, who was working 30 hours a week on it, is down to like 10 hours a week. So that's all good. We do have that $50,000 earmark from the state, which, according to our extremely rough calculations, we will be through, I don't know, Cindy and I talked about it today, and we're thinking probably in about a month we'll have gone through that money.
Okay.
And then we'll switch over to, we've already spent all the money that went to Melrose Wakefield, which, full transparency, more of it went to Melrose because Wakefield has this other 50,000 that I wanted to make sure got spent. And then we'll flip it over and the rest will get paid through the CARES Act money. Right. So we're keeping track.
Who's helping with that? That financial. Is that all on you, or do you have?
I'm sorry. Say that again.
So who's managing that actual fund? Do you have any oversight, or?
Yeah, I am. You mean the air?
Cindy, yeah, okay.
Yeah, that's like my job.
Okay.
Yeah. So I manage that, and I manage the Melrose Wakefield money that was given to us as part of the district, which is spent. That was a total of about $175,000, which, remember, we got a year ago, and we finished spending it in January. I think we had like 3 payrolls in January, roughly. Anyway, so anyway, the contact tracing is, you know, is going well. Anyway, so that's that. No indication that we'll be getting vaccine again. I
Right.
have been advocating that I know they're really going to be doing a push to vaccinate 16 to 18-year-olds. And I've been saying, well, that would be a really good place to have the health departments do.
Yeah.
Not, so we'll see if anybody listens or not. Our homebound, we did switch, obviously, from J&J to Moderna. And at this point, we have Harts Hill on the 22nd, their second doses, and all first doses for homebound are done. Of course, they were Moderna. We have to wait around 4 weeks to do second doses.
Right.
When I signed up for the program, I told the state we would do it till May 1st because, with a 10-dose vial, I just didn't feel like there would be sufficient demand to have, 10 patients. So next week being the end of the month, we have 17 more to do in Melrose. So any Wakefield calls that we get between now and then will fill up.
Yep.
So to get to the 20, and then we'll stop and turn it over to the state because, again, doing dribs and drabs is just not enough.
Yeah, it's too.
It would just take too long for somebody to actually get vaccinated.
Right.
So when we're all done, I'll give you a count of how many homebound we've done, as well as Harts Hill, which I can't remember off the top of my head. I did remember, but now I don't remember. I think it was like 40 something. I don't know. I think it was about 40 at Harts Hill. But anyway, so the good news is almost done. No, I think we are done with all first doses for homebound. So that's great. Rick's been getting us the volunteers. We'll set out the calendar for the rest of the second dose homebounds, and we're done. And Cindy and I were at the Converse building today. I took the vests, and I'm going to drop them off at a laundromat to have them all washed. And we packed up. Cindy had gotten some big totes and had done the inventory. So we packed everything in totes and 2 screens, the totes, 2 of the large Sharps containers empty, and we'll have DPW move all of that down to the Heard Street building, school, whatever it's called. So that'll be there with inventory for the next pandemic.
Is the inventory going to be, seems to me that the emergency director should, I was thinking about that after a conversation, that he should have his hands on the inventory, and then should anything happen again, it would be.
Well, there's 2 different inventories, Laurel.
Yeah.
So he has inventory and he has locked 2 rooms down there.
Yeah.
We have our own inventory because we have our own funding stream that until the end of May, I'm responsible for.
Okay.
And I'm responsible for making sure that it is used for public health.
Okay, gotcha.
Not because there's a fire somewhere or a flood or whatever. It's specifically public health emergency planning money, FEP funds.
Yep.
So we will have an inventory. We'll put it in Excel so it can be changed, but there'll be a hard copy down there. It's not a territory thing. It's an accountability thing.
So maybe the new nurse, who's slated to be full-time, that would be one of, that would be what she would own, because
Yeah.
have to say
absolutely.
you need, I mean, because I just, the experience that we had, Elaine knows too, we were just MacGyvering that, especially syringes. And
Yeah.
I think the ability of a knowledgeable person eyeballing the list without having to look at it and pull stuff out of the closet will be really valuable going forward.
Yeah,
Once I
absolutely.
think too, you have to remember is that in having a full-time public health nurse, that's one thing that they kind of do take over the responsibility of having an area, and you really have to have your FEP, as Ruth said, it has to be really locked up under key.
Yeah, absolutely.
And Elaine, now they send us a spreadsheet a couple of times a year that we have to attest that pallet jack, yes, we have our eyes on it. It's still there.
Yep.
You know what I mean? That kind of stuff.
Yep.
Everything is in there except the pallet jack, which, is down at the city yard with DPW, but, so I'm not trying to be turfy with Tom, but he has a tendency to just kind of, it's all mine because I'm emergency management.
Okay.
And it's
No,
not.
I was just more thinking about division of labor and that's a need that we were having, that we were struggling with. But I totally get what you're saying. On board.
Well, if we were using the incident command system, which Tom certainly knows,
right,
we wouldn't have had the issues that we had.
Right.
Tom did a fantastic job in what, the EMD was responsible for doing, and, getting that building up and running with everything, in 2 weeks was outstanding. And he was able to get us, a lot of the non-clinical supplies. That part of it was fabulous. And in this kind of a scenario, he's in a support role. Now, there are certainly many other emergencies that he's top gun.
Right.
And there are other public health emergencies that don't involve emergency dispensing sites. So, water, yes. So there's a lot of other potential scenarios, but, and certainly we have equipment that DPW could use, like the pallet jack, which is why I left it at Public Works.
How did we get a pallet jack?
Well, because we had money to spend down.
Okay.
And so our group, the regional group, said, what do we want to buy? So we bought those privacy screens. So each community got 2 privacy screens. And at one point, I think it was last year, we did the pallet jacks. At the end of the year, we needed to spend money down, and they have a very limited list of things that we can spend it on.
Oh, okay.
So that's why we ended up with a pallet jack. Very cool. I think that's it for COVID. I'll just give you a piece of info, and you can roll your eyes, but yesterday we were told, and DESE has sent out new guidelines that people in schools are not close contacts unless they're less than 3 feet apart, not 6. However, graduation is still 6 feet apart.
Yeah, okay.
And I'm not going to try to explain it because I don't think there's any good explanation.
Is that,
but that's the way it is.
Yep.
That's the deal. I haven't heard back from Doug about pool testing, though, as to whether the state has decided to pay for it the rest of the year and through the summer. And I know thinking about it, but I haven't heard back because we didn't do the Tuesday meeting this week because they're on vacation, whether he's going to do the pool testing. I tend to think not, but I will find out. I'll double check. So what else? Nothing. I don't know. Cindy, where's Cindy?
Hey,
Oh, there you are. Am I missing anything? I can't think of anything else that's happening right now.
but no, it's just permit season starting with farmers market and pool applications are being submitted and
Not even, yeah, because they all like to be open for Memorial Day.
so we'll see.
So it goes. The only other update I had is we were told yesterday on DPH's call that the regional grant that we applied for, they'll announce who's getting funded either the end of this week or the beginning of next week. It takes effect May 1st, so they're also under the gun to get this out. So I'm really, really hoping that we were successful. We'll see.
So there was a grant that was announced in the local paper yesterday, which I think we found out about months ago. 14,000.
Yes.
What was that?
Yeah, that was the grant that I told you about from Melrose Wakefield Hospital.
Yes.
And Kara and Jen did press releases. So that's the mental health grant,
right,
to decrease stigma and increase use. And it's 3 years. So the first year is a lot of assessment. And that increases Kara's hours for an additional 4 hours a week. And the Mass in Motion grant was extended for another year. So poor Kara. So she's working 28 hours a week through 3 different grants. So 12 hours a week with the DFC grant with the Yaddles, 12 hours a week for Mass in Motion, and 4 hours a week on the behavioral health.
I feel like you need a bar graph in the office.
Yeah.
On who's working on what and how much of their time, even for themselves. A lot of.
I actually do have a spreadsheet chart kind of thing that I give to, because we used to have a member on the Board of Aldermen in Melrose that, in Melrose we have more grants, and we have like 8 or 10 different funding sources. So I do have a chart that lists all the positions and how they're paid and all that. And I give it to them every year because they used to ask for it every year. Now I just give it to them. So
yeah, that's not a bad idea.
It can be confusing. Not as confusing in this office, but it's not a bad thing to give.
I would say that's going to be the most confusing thing to your successor.
Yes, we'll have lots of visual aids.
Yeah, I think we're going to button it up, get some visual aids, because we can't call you every 5 minutes. Well done.
So that's where we're at.
That's it, Ruth, huh? Well,
yeah, things are going well right now,
Yeah. Cases are there. They're there. Let me tell you, a lot more complicated.
Really? Any trends, Elaine? I was just looking at the cases.
I think we're seeing the past week or so, we've seen a lot of people who are vaccinated coming back positive, and we've turned them into the state. I've noticed a lot of people in between the first and the second, they're not waiting their full 14 days between the two when they're traveling or they're going somewhere, and they seem to think that they're vaccinated, and you're not fully vaccinated, and you have to re-explain it. And seeing a lot of family involvement. Cases are coming in that you've got 7 and 8, or you've got a kid over here and one's in a private school, one's in a public school, this one plays football, that one plays baseball. And I did a case today, it was like 3 hours, and I was like, I'm still shaking my head like this, making sure I did everything right. And sharing it. Also, you have to remember, you have anybody who does any traveling or picks up anything in dancing or gymnastics, it's out of the city and out of the town. So you're sharing maybe with 2 or 3 different other communities at the same time. That's the only thing we see. And this this new like breakthrough, I guess the state is saying there's a bunch of people that they're trying to link together. I don't see any, the best thing that has happened is the information system. Now, once you're vaccinated and that's entered, it automatically goes into Maven. So it's great when you open up that case and you can look in there. If they don't know their information, or before I even call them, I can look in there and I can see where they're at with the vaccines, which is that helps
Oh, that's
a lot.
great. That's huge.
It's really nice. I love it. I think it's cool.
Hey, can
I know,
do-
we're nerds, okay? We get
Can I
excited
do-
about weird things.
Can I do my nightly Stump the Chump camp question?
Oh, yeah.
I can do it offline, but
Oh, what is it?
if at needs week, special needs week, we have a positive case, but the rest of the cabin is vaccinated, do we have to send the whole cabin home?
No.
I know. Thank you. I'm going to say no. All the experts say no. Yeah.
Well, I mean, your camp is in New Hampshire, so it's up to New Hampshire's rules, but considering New Hampshire is basically getting rid of the rules,
Yeah, they have no rules.
I can't
Well,
imagine that they're stricter than we are, and hold on, and we would say no.
Yeah. It's interesting because New Hampshire has not adjusted rules to consider vaccine. They wrote everything in March and they have not done a vaccine addendum.
Oh, wow. That's interesting, because
Well,
that is one of the biggest things that we're finding a lot in the cases, is the first words out of people are, I was vaccinated and my friends told me, or I went online and I don't have to do this and I don't have to do that and this is that. And then you go, well, you really, why don't you just take a day or so, or, think about this, or, but that's what it is. And I'm totally, confused with New Hampshire. I mean, I'm trying to keep up with them too, because
there's a lot of local rules. So I can tell you that the guys at the New Hampshire liquor store, not that I go very often or at all, but anyways.
You heard it from a friend who went there.
No, I had to get a gift, let's just say. And big guy with a pack of masks at the entrance. And I said, you getting any pushback? And he said, originally this morning, but Portsmouth has local rule. And I think all of the state liquor stores and many of the stores. And I think the assumption that they're making is that people don't like to be told what to do, but if you ask them nicely, they will. So it will be very interesting to watch.
I'm going to New Hampshire this weekend. I'm not happy about it, but it'll be interesting to see.
Yeah. Well, I wish you were happier. Saturday's going to be nice.
Well, it's fine, but I don't want to be around people who are not masked.
I gotcha. Yeah. And
go over by UNH. They're all have their mask. Everybody over in there and all the towns is still keeping it. But I know further north,
Hitchcock, I think places where there are hospitals, Concord. I wonder if there's a map of local mandates.
Yeah.
Well, you know what? The more urban areas will, and the more rural areas won't.
And all
academic centers, medical centers.
Yeah.
Chain and
normal.
Chain, large stores and chains are. So yeah, this is going to be interesting. Do you think we need to do any more messaging through our fabulous website on kind of, just
the last 2 Friday mornings, we have been doing a lot of messaging that this is not over. Please keep wearing your mask. Please keep social distancing. It feels like it may be over, but it really isn't. And so we've been doing a lot of messaging that way. And I can talk to Jen about.
I need to send you someone had this hysterical YouTube cartoon, and it just it might be that we just need to refreshen things so people actually look at it. But I got permission from. I said, "Can I push this?" It was hysterical. It was basically a big COVID.
I see a lot more people not wearing masks in town.
Yeah.
Yeah, I mean, just at the gas station at Cumberland Farms today, I was like an outcast with my mask on, and running around town. I mean, there are definitely people that pull it up when we cross.
Right.
But most people, when they're out and about, they're free.
Yeah, I mean, people holding signs for campaigns have been, in fact, people have been buying campaign face coverings.
That's cool.
So
yeah,
the election is
a lot of certain campaign sign holders kind of over near where the farmers market is. I mean, on top of each other.
Yep.
No
Well,
mask.
yes, well, I know. That speaks.
Elaine, you can add that to your list of questions.
Oh,
Have you been
about
holding signs with a bunch of other people?
Add another one. Just keep on. Have you been in the pool? Have you been over here? I love the pool question because everybody laughs. And I said, well, unfortunately, the CDC is in like warm weather, so they think we're all in public pools.
Yeah.
Oh, good
Can I
point.
tell you?
And why would that matter?
I know. Doesn't
mean,
the chlorine kill it?
Yes, of course it does.
No. Well, the pools, you know, it is people are right beside each other and they're talking and having fun. So,
I am
and I think what they mostly were trying to get at was pools as a public pool, not only in like a backyard, but I think in more gym type of things and things like that in the YMCA, because a lot of people tend to. I noticed that. We had one time and she said, oh, well, they didn't have exercise class. They just went to the pool. Oh, the pool. Okay. Here we go. We're in the pool. We're in the locker room. We had a change. We're here. Yeah. One thing leads to another. But let's hope.
And they're on it. They do a good job keeping the classes small. And when folks are swimming in the lanes, there's no sharing. People have their masks at the edge of the pool. The locker room is limited. And at least when I'm in there with my kids, there's like nobody in there. So I haven't been to a fitness class, but there's definitely fewer people at the pool. So I think they're fine.
Yeah. Well, Elaine, I recommend you take some vitamins because I'm a little worried about 4 days when people return from April vacation.
I have been taking mine. I just had that conversation earlier today with Karen, and yesterday we talked about it, and I think it's going to be very interesting. It's very interesting to listen to people who are traveling, what their take on of flying is, of driving is, and staying in restaurants in different states as to what they're seeing, and how some are very upset that people aren't taking things seriously anymore, and how some say, oh, I had a ball because everybody else took the mask off. I did too.
Yeah.
Okay, there it is. So
I'd say that young children can basically do what their parents are doing, right? And so if parents, like my husband and I, we're both vaccinated, and so we basically can return to our jobs. We don't have to wait. We don't have to test. But our kids
hold on. Only with the travel guidance. So yes, travel guidance, kids under 10 do what their parents do.
Right.
But not for other activities.
No, right. But still, that seems, I mean, that's what's out there, but it just seems interesting that all of a sudden kids 10 and under just don't have to test, or, you know, they don't have to have a negative test before returning to a group setting. I mean, this isn't really the place to discuss it, but I just think as a comment, it's interesting that's what's out there.
I think you're just seeing with the opening up in so many different places and so many like colleges that didn't go on spring break, or those that came home for holidays, for weekends. I think that's where we're starting to see the difference, because they're intermingling with people that have been in other states, and well, how come you didn't have to do that and I have to do that? And I think that's where we're starting to see the change, instead of we've all been together and everybody in the neighborhood has a mask on, so we'll wear a mask. It's to be something to be cool about. You know, I don't know what it is, but I'm hoping next week it isn't as bad as it was after Christmas.
Let us know. We'll bring treats.
Yeah, more than treats. We'll need.
So I fought with myself not to enter the campaign fray. I'm helping other people, but I did not do a candidate statement because there's too many other candidates for people to worry about. But I may do a post-election kind of update and thank everybody. So stay tuned. I'll write a nice letter.
And Ruth, just to take the time publicly to thank you for your service. I've had the honor and pleasure of knowing you before you came here, and knowing your reputation. And I feel so bad that so many people are going to miss you out there in public health. I've heard so many comments from people lately, and you've always been a voice. You've always been that advocate. You've always questioned, and you've always just keep on questioning to make the best outcome. And I don't know how to thank you, but I wish you the best. And I hope you send postcards every month from a different place.
Just to torture the office.
Yeah.
Thanks, Elaine.
I concur, Elaine. You know, I cannot believe this. So Elaine and I both started this gig in 2009, and you came on just then.
Right.
So it's been my whole public health experience. You've taught me so many things, and I really, really have loved it, and really will I'll Facebook friend you again, and
It's been fun, and it's
we'll
been a
keep
great,
keep it on.
the last 12 years, you know, there's been a real journey
Yeah.
and a real transformation, I think, which could not have happened without the support of the board and the support of Steve. If you remember the first year when we were like actually enforcing the rules, and parents of kids in camps, why do we have to do all this paperwork? We've never had to, you know, and Steve would say, well, don't you want to make sure your kids are safe?
Yeah.
You know, I mean, he really backed us up, and you guys backed me up, and we wouldn't have been able to make the progress, you know, without the backup, really. And that's important. We have
It
a
reminds me
great staff, we have
Yeah.
great people, and I think I think the pandemic has really shown that.
Yeah.
Well, everybody has pitched in, literally everybody's doing contact tracing and using Maven, and
Yeah.
you know, Kara and Catherine and Coral and Cindy, so, and you guys. So it's just been a huge team effort.
Well, in your term here, we went from Wakefield never showing up to regional meetings and not being a presence to being a rolling demonstration project. I mean, it's just amazing when you talk about transformation, what the difference is. And I remember getting onto the board and really doing research prior to you coming. And, you know, we have a professional board, we have a professional health director. And I do recall telling the band parents when you came on that there was a new sheriff in Dodge. And that was why they had to simplify their menu. For the love of God, stop serving fish.
Yeah, I know. Yeah, they're always the challenge.
Let us not have a clam chowder fiasco.
Yeah, we got stories.
We definitely will be able to meet and talk and enjoy it.
Absolutely.
All right, you want the next meeting, you want to keep on our third Wednesday of the month, which would be May 19th.
Yep, that's how I have it.
Okay.
Well, hopefully we'll be able, Elaine and I will be able to say we have a new person starting and this is who it is.
Okay, keep
So
us posted.
we'll see. We'll see
I'm
what
hoping.
happens.
Well, best of
Can I
luck,
make
Elaine. Thank you.
I'm sorry, I didn't hear you, Laura.
Thank you, Elaine, for taking this on. I know you're doing everything else, but
Yeah, it's just like being back in work. I don't know.
you have all the. You didn't really retire.
No, I
Or
didn't.
thank God you retired, and this is your post.
Yeah,
This is like
this
New
is why
England.
yeah,
This is like New England spring. This is your second winter.
yeah, that's true. Why not? Why not? Okay. All right, can I have a motion? It is 7:49 to adjourn.
I'll make a motion.
To adjourn the meeting.
Candace has
Yeah.
it. I second that.
Laura will second. All in favor? Laura?
Corville, aye.
Hannah.
Silver, aye. So moved. We are now adjourned at 7:50, and see you again on May 19th. And hopefully by then we may have some news. It'll be good news and sad news at the same time, but it'll be to go forward.